your shoulder, drop that. Yep. Perfect. Blow. Open, let it go. Good girl. Good. Let that open up. A little bit more. There we go. Good. Blow it all out. Perfect. Really good. Ear to shoulder. Beautiful. Lisa's back. And we're going to follow up with her. So I had a chance to talk to her. And shoulder's better. Leg is better. You got better range of motion. It's still a little sticky right there. But it does get sore when you do your activity of daily living.
Yes.
But what we're focused on today is the low back, because the low back wasn't as bad before. Now you're at about a 5 out of 10 when you get going in your day, right? So bending forward, doing laundry. Does sitting bother it?
Yeah. Yesterday I was sitting.
Yeah. And when I push out here on your SI joint, does that hurt?
It just feels like a pressure. It all feels like pressure. It doesn't feel like pain.
How about right there?
Yeah, just pressure.
Okay, good. And then if I push in the middle?
I mean, that hurts a little bit.
A little bit, okay.
Yeah.
And then if I push here?
A little bit. More pain coming.
Yeah, and if I push here?
Yeah.
Okay. And if I push here?
Yeah.
Okay.
The same type.
And if I push here?
No, nothing really there.
Yeah, so off camera we were talking about we were kind of joking just now, but like what causes back pain? And you had an interesting experience with a PT that said, oh, women have big hips. Well, what I do notice in your spine is we have a curve in our lumbars that's a reverse, a C curve right there. And then you have your tailbone, right? So then the curve for your back kind of does this. So you got a nice curve. That's a shock absorber right here. Okay. You have a pretty good sized curve. Sometimes when it gets a little bigger, you call that a hyperlordosis. That can put pressure on the lumbar spine. And that's just how you're put together. There's nothing, really to do about that. Now, can we get you stronger? Can we get you better balance? Take some of that pressure off? Yes. But what we're going to do today is we're going to do the Shockwave machine on the back first. Because if there's any inflammation or damaged tissue, that's what's going to help bring your pain down. And it actually stimulates stem cell production, which we want, right? That's healing. Yes. Increase the blood flow, because blood is life, right? And that's also healing. So let's start with that, and then we'll do an adjustment after that.
Okay.
Okay?
Sounds good.
Good. So I'm going to have you lie down on your stomach. Perfect. Now, I'll show you what it feels like before I get started on you, okay? I'm going to just put this so we don't get any ultrasound gel on you. We're going to come down to get in your lower back. Good. Now, if I'm pushing on your back as you're lying there, do you feel that more?
Yeah, I do.
It's
I
a
feel
little
it more,
bit stronger.
Yeah.
Yeah, it did
that's
change.
so weird that you feel it differently when you're
it did change.
Yeah, now it feels like pain.
Okay. All right. So what we're going to do is so this Shockwave, it puts sound waves through the tissues faster than the speed of sound. Put a shock to your system.
Oh, Lord.
But like I told you, if there's no damaged tissue or inflammation, it doesn't feel like anything. It's just like a tapping noise sensation. So ultrasound gel just helps transmute that. I'm going to put it on your hand so you feel what it feels like first. So that's what that feels like.
Okay.
I'm going to do that again. Feel that?
Yeah, it's over.
So there's no pain.
No pain.
The tapping. We're going to...
Pain-free.
Okay, so we're going to get started on the low back. And what you're going to do is you're going to just tell me what the number is. You're going to call it out. 1, 2, 7, 8, 9, whatever number it is, okay?
Okay.
So it might take a minute to acclimate. Let's start. What do you feel?
I feel like 1. Still.
Okay, good.
Oh, I did feel like a 3.
Okay. I just want to give you a second to kind of feel how it feels.
Oh, yeah, that was like a 5.
Yeah.
5.
Yeah. So the intensity can get up there. I'm going to come over here to the right. We're going to first just seek out some of the spots.
Like 7 or 8 now?
Yeah, that's where we want to be. Yeah, so I'm going to just stay here for a sec. That's right on your...
there. Oh, my gosh.
Yeah, it's your sacroiliac joint.
It's what?
Your SI joint.
Okay.
Sacroiliac.
SI joint.
5, 4, 3, 2, 1. How about in the middle? Anything in the middle?
Oh, right there.
Okay, right there.
Yeah.
What number?
I would say like 8 still.
Yeah, perfect. Five, 4, 3, 2, 1. So I'm going to come up. Anything as I come up the spine?
Right there. Oh my gosh. That's like 9 or 10.
Okay. So more than likely have some low back.
Oh,
And it could be degeneration is what I meant to say. Obviously you have a low back and obviously you have pain. Anything in here?
No, just right there.
As I get on the spine. Not,
yeah.
Yeah. Okay. So the disc lives there. We have nerves there. How about if I go over to the left?
It's okay.
So it's more on the right.
Yeah.
And that lines up with how you feel sitting on the couch.
Yeah, it seems like my... Oh, right there too.
Okay.
8. That's the 8. It's definitely a 9, 10 in the middle. And then...
Yeah. So we're going to spend a little more time right in the middle. What do you feel?
Yeah, right there. That's the 9, 10.
Good job. 5, 4, 3, 2, 1. Good. Anything up here again?
Right there.
Yeah.
Yeah.
Doing good. 5, 4, 3, 2, 1. How are we doing in here?
That's okay.
Okay, I'm going to come over to this.
Ouch.
Yeah. What
Yeah.
number?
The 10.
Yeah. Okay. So you do have quite a bit of information in here. So it was a good day.
Yeah.
We're going to do a couple more. Is that okay?
Mm-hmm. Oh yeah, it's definitely inflamed.
I just want to do a couple more right on your hot spots. 5, 4, 3, 2, 1. And I'm going to come up the middle. There.
Yeah, it's good.
Okay.
And then right there, it's
Okay.
that 10 that I was talking about, 9, 10.
10 more. 5, 4, 3, 2, 1. Good. Really good job. Almost done. 5, 4, 3, 2, 1. And that, my dear, is a full Shockwave treatment.
Wow, that's
Now I can do that
nice.
on a shoulder, on a knee, on a foot, hip, elbow, wrist, neck. Now we're gonna stand up, and I want you to kind of shake it out and see how that feels. Perfect. All right. It's interesting, right?
It is very interesting.
Okay. So kind of shake it out, see what you feel. All right, now if I'm poking around on you, what do you notice?
Less pressure.
How about
Pressure.
there?
Still feel that pressure though. The inflammation. Now I can actually understand the inflammation
Yeah.
because of the
Right.
Shockwave treatment.
Yeah. Good.
Whew.
Okay. So the other thing I wanted to look at is,
I always try to stand up straight though because I know posture is important. But
well, I think
Right,
sometimes
or-
we have to work on balance, and then posture becomes easier.
Oh.
And then there's certain parts we'll have to make stronger. So raise your right knee up to your chest and down. Now do your left knee.
Oh, I remember to tell you something. I have a cracking sound also with the right, and I've noticed it. It's when I go like this, like that, and I hear my hip crack.
Your hip, okay.
Which is funny because it's that
That's
back
the side.
part.
Yep.
Yeah.
Yep, I'm telling you. So when the hip isn't moving correctly or it is not moving enough, the hip will put more pressure on the low back.
Got it.
Right? So the SI joint, the low back, everything has to work harder to make up for that motion that you've lost. Okay, so now bend forward. Not bad. And come back up. Little lag on this right side. Come back up. How's that feel?
I felt the lag too.
Yeah.
Yeah, I felt like the pull here.
See how much more wear you are getting?
Yeah.
Okay,
like
so then we're going to work on that. We're going to go adjust you.
About your own body, you know?
Yeah, and then we're going to do some more adjusting up here. I think that will help through here.
I'm a stiff person too, so it's kind of like...
Well, when's the last time you took care of yourself?
Yesterday.
That's right. We're gonna go. Let's go adjust you. Come on.
I try to do like all that self-care stuff.
Okay. Let me get my. Okay. Do you remember? Did we talk about this on camera? Did we talk about my
to
little?
lay on that thing?
Yeah.
Yeah.
But did we talk about where it comes from?
No.
Okay. So there were some comments. Go ahead. We're gonna lie down. So there was comments because I thought so. I thought the sheepskin, like they shave them every year, right?
Mm-hmm.
I think once a year they shear them. Nobody gets hurt. Everybody just loses their clothes. But that's, I guess, where we get wool from, right? Well, when it has the leather on it, that means that, yes, the skin is off, and that means the animal is. However, this company that I got it from, East Perry, they get it from, I forget which country, but they're sustainable farmers. So they're using the whole animal, and they're raising them, small farms raise them for meat, because in that region people eat a lot of
sheep,
lamb.
Oh, lamb.
Which is not a sheep, right? But anyway, I learned something from my viewers. So this is just doing a little decompression, because remember that lordosis I talked about, we have a little bit extra curve. So as I will apply traction to the top of the sacrum, that helps relieve some of the compression that's happening right there.
On the SIC joint, right? SIC joint.
SI joint.
Oh, SI joint.
Sacroiliac.
Oh, sacral. Yeah, it's sacred.
Yeah.
That's how I remember it.
Good job. So one of the other questions I got was about when I lightly touch and then I check people's feet. It's called a stress test. So I can also stress test and watch their feet react. And if they don't line up, I know that's not what I need to do. So sometimes I just do it fast but you can see that difference.
You see a difference?
Yeah. So then I know which way I should need to adjust you. I'm not guessing.
Oh.
Well, what are you going to do when hubby goes away? You go with?
I just do me. Going on a walk this Saturday with a friend.
Wow. Like a special walk or?
Yeah, we're gonna go get those ice pops.
What is that?
There's some ice pops on the Riverwalk. They're delicious.
Oh.
Yeah, they're homemade.
Ice pops?
So yeah, it's like you get a reward for walking at the same time. Yeah.
I want to go. I like ice pops, I think.
Yeah, they're refreshing. Popsicles.
So that was your right hip. I'm looking at the sacrum, see if there's anything else you need there. So we're rummaging around on your front. All right, now take a nice deep breath in. Let it all out. Blow. Open, let it go. Good girl. Breathe in and out. Good. Little stretch here. Okay, so let's check. Raise this right leg up to the ceiling, okay, and down. And do the left leg and down. Did either side feel heavier?
Mine was right.
Definitely, right? It was a big difference. So let's have you lie on your left side. Let's see if we can get some more motion on there.
I just need a whole, like, robotic right side. I think I'll be fine.
At 30, we're not going to do a spine or a skeletal transplant, okay? Bring your hips towards the edge. There we go. Good. I don't think you're ready for that. You don't need that.
I'm like a cyborg.
Not yet. Okay, we're going to just stretch this open this way. Good. Let that open up. A little bit more. There we go. Good. Okay, we'll go the other way. We got some motion there. Camera or my mic's still there. Yeah, we're good. Okay, I'm gonna stretch. Good. Nice deep breath. Blow it all out. Perfect. Really good. On your back, sweetie. So is this easier the second time around?
Yes. Because now, like, I know, like, I did forget to do the deep breathing, though.
Any headaches since I saw you last?
No, not really.
Ear to shoulder, drop that. Yep. Perfect. That's good.
Yeah.
You got a little teary on that one.
Huh?
You got a little teary on that one.
I did.
Ear to shoulder. Beautiful.
I'm just sad about all my pains.
Hmm?
I'm just sad about all the pains that I'm having. Like, it's like, ugh.
Yeah, but it's not for forever. And
Thankfully,
that's
it's a doctor.
that's why you're
It's my
here.
doctor over here.
That's why you're here. Because
Yeah,
you
but I
can
never
do
had a chiropractor in my pocket before, you know?
right. So when I say, when's the last time you took care of yourself, and you say yesterday, but like, tell me, your nervous system runs everything, right?
Oh, shit. Yesterday all I did was, like, soaking.
Right, and that's good. That's
Yeah.
good for your nervous system. But to get to the root and really do the care for your body to heal, that's why I
Well,
think.
it started with you then.
Yeah, just started.
Yeah.
Good. Good.
I felt the crack.
Yeah, me too. Okay, good. All right, so let's just check the hips. All right, this is the left one. Yeah, good.
And like I know like I have good flexibility, but I don't know since because of whatever's going on with my right side, like my flexibility.
Well, our flexibility is one of those things that will also change. Change with nutritional status, change with hormones, change with, you know, different types of life, right?
You see, I feel like...
And flexibility isn't really always the goal. That, you know, we want mobility.
Mobility.
And we want activation. And you feel that when I come across, yeah?
I feel it here.
Okay, when I come out, is it okay?
I still feel it here, yeah. Yeah, right here. I don't know, or somewhere. Somewhere up here, I think. Ooh, yeah. I think that's the thing. I don't know where it's at. I just have like an area, but I don't know exactly.
Never drop this way.
See the crack? Yeah. But it's more mobility.
Yeah, and cracking, I kind of, it can mean something, it cannot, right? It, you know, so people say, well, cracks all the time. Well, sometimes it's like that connective tissue, the ligament or the tendon snapping over the joint. It can mean something's not sitting in there correctly, or there's tension.
I think there's just tension.
Yeah. So, and that takes a little bit of time. So we got to work through. So I'm going to have you roll up onto your left side, face that way. On your hip, yes, good. And then just rest your head just like that, perfect. So we're going to work in your butt for a second.
My butt.
Well, your glute, how about that? Let's clarify.
Oh.
All right, you feel that?
Yes.
So there's a lot of these glute muscles that attach into the femur head. So we're going to start in here. So I'm going to be holding this muscle with my hand, and you're going to bring your knee to your chest. If you need to grab it, you can.
This knee?
No, this one. So just keep the leg straight till I tell you. Yeah. And then we'll see if you can move. Okay, go ahead. You can move it now. Bend your knee.
This one?
Top knee to your chest. Right knee. Out. And come back. Is that as high as you can get?
I think so. Let me try again.
Go ahead. And then you can use your hand if you need to.
Oh, okay.
Good. Yeah. Yeah. You got it. You got it. You got it. Good. Good.
Oh, that feels so, like, tight there. Yeah.
Good. And then straighten that leg out. So this didn't happen overnight. Go ahead. Good. Yes. Perfect. Good job. Go down. Did you feel more towards your middle of your butt or more here? Okay, let's do one more in the middle. Good. You got it. You got it. You got it. You got it. It's good. It's good. It's good. Good. And then let it go. Okay, so it's going to feel a little bit like where my thumb was. But let's go on your back again. I'm going to retest that hip.
That feels so much better.
Yeah. A lot less clunky.
Yes.
You know, it's still in there, but I don't want to overdo it. We've done a lot. We've done the Shockwave. Now we've done some release in the soft tissue and adjusting. Okay?
Mm-hmm.
Feel good?
Yeah.
You're going to be ready for a nap.
I don't disagree.
Stand up. Let's shake that out.
Like you're like working out. Yeah, working out.
Yeah. Well, we're resetting all of your nervous system. Yeah?
Yeah.
Good. Good breath. All right. Now, how are we feeling down here when I poke on you?
Oh, it's feeling much better.
How about in the middle?
Yeah.
Okay.
All less pressure.
Good. Okay, and now bend forward and come back. Less of a hitch, right? Did you feel that? You like did a good job.
Fluid over here.
Yeah.
Yeah.
That looks a lot better.
It's crazy.
So, and that's just number 2. So we'll do one more. But just continue to be aware, but not go to the place of. So I'm going to give you some exercises. Let's see which exercises do we want to do. So we want to work on the hips, right? Mm-hmm. So one thing to do while you're standing up is to just do open and close.
Oh, okay.
You can hold on to something so you can have your balance. You go nice and slow. You want it to open. You can do it lying down. And you're going to just hold this here. Feel this gentle stretch. I don't want you pulling super hard. You're not trying to crack yourself. You're just trying to stretch this glute muscle. And then you can push your knee into your hand and relax and do a little more stretch. Because sometimes to get a good stretch, we have to kind of trick the body.
Got it.
Right?
So stretching.
So you activate it. You just pushing my knee into my hand, and then I'm relaxing, and then I can do a gentle one. So you can do the hip both ways. And then obviously when you're lying down, you can open it up too.
Got it.
Okay? So that's for the hips.
Practicing that.
Yeah. Yeah. And I think you're standing, right?
Watch it.
Yeah. If you stand, lock your knees, stick your butt out.
You want me to lock my knees?
No, I don't.
No, okay, yeah, I don't lock my knees.
Yeah. So keep them soft, and then I want you to practice tucking your tail. Yeah. And
like
at first
that?
it'll feel like because you're shortening, you're bringing your ribs towards your pubic bone. So you're here. So this
Am I
is
doing
locked.
it right? Hold on.
You're locked, right? Yeah. Go on your back. I'm going to show you how to do it on your back, because sometimes it's easier to do it on your back.
Okay.
So it's called the pelvic tilt. Bend your knees. Good. And you're going to flatten your back into my hand. Flatten all the way down. Just like that. That's what I want you to do. So flatten.
Am I doing it?
Use your hips. So
Gosh.
push your back. Yes. Yes. Okay, so you're pushing your back.
Oh, you feel like a little core ab
you're
engaged
pushing your
there.
back. See, it takes a second. It's okay. This is normal. These are muscles that don't have quite the connection. So flatten. So it's a gentle tip with the pelvis. Yes, and then you can gentle rock.
Yeah.
So so you flatten the back and then rock up. Yes. So what I want you to do is practice flattening. Yes, right there. And when you're there, when you rock, you tilt the pelvis under, and then you have this engaged, pull the belly button into your spine, and then you're going to activate your glutes.
Okay.
Okay? So first step, flatten. Perfect. That looks good. Now squeeze your butt together. Activate through the butt. Yes. You don't have to lift up.
Oh, okay.
I just want you to
no
squeeze.
Hip thrust.
So flatten.
No hip thrust.
Not yet. Let me move my face. Flatten your back. Flatten. Good. Now squeeze your butt together. Squeeze. Good. Just like that. And then you do a series of those. I want you to, you can do, so when you get good, you can just stand up. So you're doing the hip thrust, and then you're squeezing and activating the butt.
Got it.
So a couple of things. This is good pelvic to know how to activate and to move the pelvis.
Yeah.
We already did your hips, and then we're going to get into glute activation.
Nice.
All of those things have to be there.
Okay.
Then once we get the glutes strong, then your body learns that that's what holds you up. And it's less about right here. Because right now,
distributing everything.
Yeah, right now everything that's what's holding you up. So it'll take some practice, but every day, as many times as you want,
all right,
till you kind of get that
figured
connection.
It out, yeah.
Yeah.
Cool. Okay. Nice.
Sound good?
Thank you.
Okay, so that's your homework, and then we'll see you back in a couple weeks and see where you're at.
Oh my gosh. Yeah.
And we'll miss you, but be safe.
Thank you.
We'll see you when you come back. Okay, so Lisa's out for today.
Thank you.
So like and subscribe.